You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, PHAP President, Dr. Jose De Grano. Dr. De Grano, welcome back to The Source. Maraming salamat din po sa inyong oras.
Yes po, ma'am. Good morning po sa lahat po natin mga viewers. Thank you.
First, I want to talk about, sir, itong COVID cases because yesterday, the DOH recorded 716 cases. Isa ho to sa pinakamataas in the past couple of months, and 322 cases were recorded here sa Metro Manila. Just a quick update on the COVID situation in private hospitals. Kamusta na po? How is the hospital utilization? Meron na ho bang concerns regarding this?
Yes po, we can see na talagang tumaas po ulit. Actually, nag-plateau siya somewhere in vicinity of 400 to 500. And then ngayon biglang tumaas sa 700 plus. So hopefully hindi na tataas pa po dyan. But then mas maganda po kasi because the symptoms right now of COVID are mild, and at most moderate. So that's most of the patients do not require hospitalization. So yun po, ating hospitalization, the utilization rate is still low. So the hospital can still manage.
So wala pong nagsasabi pa ng possible concern na dumadami yung kaso sa kanilang ospital and in terms of staffing, equipment at gamot?
So far, wala pa po na nagsasabi sa amin. Medyo tumaas ng konti siguro from a week ago na mga around increase ng 5%. Siguro nag-increase lang siguro ng mga another 5%. Siguro mga around 10% na. But then still manageable pa din po yun. Anyway, kaya pa rin ng mga existing healthcare workers po.
Yeah, I was talking to Secretary Duque yesterday. Ang sabi nga niya po, posibleng umabot ng kahit as high as 2,000 ang COVID cases. With that, sir, the hospitals can still manage. Will you be able to tell us that the hospitals will still be able to manage that?
Yes, because most of these cases are what we call as incidental COVID. They are admitted for other cases, but then nag-positive sila during the routine testing.
Okay. I asked him, sir, about the one COVID allowance as well. From last that I saw, it was reported that over 100,000 na mga frontliners, healthcare workers and non-healthcare workers taking care of COVID patients have not received their one COVID allowance. Sir, ilan ho pa ba talaga ang hindi nakakatanggap? This is a range of 3,000 to 9,000 pesos.
Yes, actually, ang laki po niyan. Alam niyo naman po na na-release dyan is 7.92 billion in February. It was released by the DBM. And then they notified us. So most of the hospitals submitted yung kanilang mga tinatawag na documentary requirements, memorandum of understanding, and everything na kailangan nila. But then when we complained that 3 months after or more than 3 months after, hindi pa dumarating itong mga COVID na reimbursement or the claims, the OCA claims, ngayon po, sinasabi nila man ngayon, kasi they have not liquidated the previous one. Yung po sinasabi nila. Why only now? Wala silang sinabi previously. If you will note the guidelines given by the Department of Health before, it was never mentioned na we have to liquidate these things. And I saw the 178 million supposedly unliquidated funds ng mga hospitals in their list. But now, hinahanap po yung list na yon, biglang I can no longer find it. I don't know. Kahit si Mr. Google, hindi ko makita. I don't know where that list came. Kasi gusto kong i-verify talaga this number of hospitals kung talagang hindi sila nag-liquidate. Opo.
Dr. De Grano, can you explain that to us? Ano ho ba ang kailangan i-liquidate ng mga ospital? Because from my interview with Secretary Duque yesterday, I had asked him about this. Ang sabi niya, kailangan mag-liquidate muna yung mga ospital because sabi niya may pera naman. Ang problema, hindi kayo nag-liquidate yung mga private hospitals kaya hindi nabibigay yung one COVID allowance o OCA. Kasi kung hindi daw ma-liquidate, ang DOH naman daw magkakaproblema, especially when it comes to the COA or the Commission on Audit.
Yes, ngayon po ang ginagawa nila they are trying to parang ang ginagawa na nilang excuse ngayon yung COA because of the discrepancy. At samantalang sabi nila they have already downloaded the amount to the different CHDs sa different regions. And then we're wondering why nasaan na yung pera? Kasi wala after the different regions, nawala na sa different provinces, nawala na sa mga hospitals, walang dumarating. And these are supposed to be going directly to the private hospital. Kasi unless yung mga hospitals are LGUs or under the LGUs, that's the only time that it has to pass through the LGUs. But the rest, dapat diretso ito sa private hospitals. And then there are instances meron pa pong instances na sinasabi nila na pag chinek nyo daw sa portal, nakalagay daw doon paid na. When in fact, they are not receiving anything. Yun po.
Really? Opo. So what do you do now with the DOH saying that the hospitals must first liquidate before funds can be disbursed? How can this be settled, Dr. De Grano?
Yes. The thing is, what are we going to liquidate? Most of the hospitals that I talked to, they said that they have already liquidated everything. I mean, most probably it's the SRA, Kasi yung SRA, yun po ang involved sa private hospitals. But then the MAT and the others, yun sa mga government facilities, So I don't know how they're going to do about it. But then usually the private hospitals, after receiving it, I don't know, they have to define ano ba ibig sabihin nila ng liquidation. Paano yun? Let's say I received the total amount and I signed for it. Yung ba ang tinatawag natin liquidation? Or they need the payroll list bago pa natin masabi?
Yeah, because it sounds, Dr. De Grano, it sounds a little absurd that if you are given an allowance, sabihin po natin a minimum of 3,000, di ho ba? Kunwari, doktor, o kaya nurse o assistant na bigyan ng 3,000 as COVID allowance, ang ibig sabihin ho ba nun, sila kailangan mag-liquidate doon sa i-liquidate nila yung 3,000 natanggap nila? Allowance nga po nila yon. Ganun ho ba yon?
Yun nga po ang sinasabi nitong aming mga kasama na, ano ba yun? Allowance yan eh. I mean, bakit kailangan mo pang But then sabi ko nga, when you receive the amount, usually the hospital medical director or the head of the HR signs for it. Ibig sabihin, they are responsible for the dissemination. Oh yes, for the disbursement of those funds.
But I guess this needs to be settled, sir, and clarified with the DOH.
Yeah, actually, I talked with Yusek Bonfega, and he asked me for the list of the hospitals, and I sent them the list of the hospitals. And then the problem is that was a week ago. So let's wait until next week and we'll see kung talagang then we'll try again.
Pero sinabi ho ba ni Yusek Vega itong issue ng liquidation?
Parang wala siya na-mention noon eh. Wala siya na-mention. Nung pagkatapos na namin mag-usap ni Yusek Vega and then I sent them then that's the only time na lumabas itong liquidation thing. Kaya sabi na na naman to? Bakit ganyan na naman? Ginagamit na naman nila yung COA, the COA thing to delay the release of this fund. Ang laki ng fund po na yun, That's billions po yan. Kaya yung po
Opo, in fact, sabi ni Secretary Duque, the money is there rather. And kulang lang nga talaga ng liquidation kasi nga they might run into problems with the COA. Okay, sir, I also want to discuss just very briefly yung PhilHealth. Meron pa ho ba, mataas pa rin ho ba, may problema pa rin ba sa unpaid claims?
Actually, there are, medyo bumaba na po. They are slowly paying back, giving us the reimbursements. But there are still questionable things like the denied claims na gustong makuha ng mga hospitals natin, especially during 2020 and 2021. Yun lang po. But then, they are slowly paying na po.
What about this issue? Are you investigating this with regards to yung sinasabi naman nilang down casing?
Well, siguro kung totoo po yun na na-mention nila na mayroong down casing, then they will just have to file a case against the erring professionals, And then don't generalize everything, Parang pag sinabi nila kasing ganun, lahat ng hospital gumagawa niyan eh. When in fact siguro may nakita lang silang supposed suspect na nagda-down case. Sasabihin nila, okay, nagda-down case sa mga hospitals na yan. That's why. So, sabi ko, well, you just have to prove it na talaga nagda-down case sa mga down casing itong mga tao na to, and then you file the case, necessary cases. Mahirap yung you're going to announce and then you're generalizing everything to the point na sasabihin, ay, mga hospital nagaganyan, gumagawa niyan.
So you're saying these could be actually isolated cases, and if indeed true, investigate and file the necessary cases?
Yes po, I think so. Kasi if they really have enough proof for it, then file the necessary case. We're open to those things po.
And finally, Dr. De Grano, wala pa pong natatalagang health secretary.
Yes.
Do you and what are your expectations or yung inyong wish list sa susunod na DOH secretary?
Well, of course po, sana po open sila sa mga, of course, masasabi nating mga problems, mga hinaing ng not only the hospitals, not only the healthcare workers, and of course the professionals involved with the healthcare system. Po, siguro dapat open sila, they are willing to talk with us. Mahirap po yung usually labas na lang sila ng mga administrative orders, etc., without even consulting all the stakeholders. Sana po ganun po ang maging mangyari sa next secretary.
PHAP President Dr. Jose De Grano, sir, thank you so much for your time.
Okay, thank you. Thank you very much.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.